Hello, everyone. My name is Sangeeta, and I'm the founder and CEO of Helpsy. Thank you so much for joining us today. We continue our book author interview series, and today we have Rick Shapiro with us, who's going to talk about his book, Hope Never Dies. And in this book, he's covering stories of 20 cancer patients who have very inspiring stories about what they faced and then the treatments that they pursued. So it's inspiring, it's radical, and it gives us a different perspective. So I'm really excited to have him here today and to interview him. Let me tell you a little bit about Rick. So Rick is a former practicing attorney and a leading consultant, researcher, and educator in the field of safe, evidence-based integrative medicine and alternative medicine cancer treatments. He's engaged in deep research about efficacious therapies that are extending and saving lives beyond statistical norms generally found in conventional cancer care. He collaborates with several renowned doctors and researchers who are in the forefront of these therapies, and he's consulted with, coached with several cancer patients all over the world. In his book, he's interviewed several um, of these MDs about the therapies that they offer, and also interviewed several patients who have tried different therapies. I know many of these providers as well as the patients. I've seen them throughout my life in the last few decades. So it's really wonderful to hear their stories and their background and how Rick came about to doing this. I think it'll shed interesting light and background into many of these inspiring stories that we have. So with that, welcome, Rick.
Thank you. It's my pleasure to be here.
Great. So tell me a little bit from the very beginning, why did you write this book, Hope Never Dies? I mean, given your background in legal and, in a very different area of practice, what motivated you to dive deeper into cancer and into integrative medicine, and more specifically to write about hope and about these stories?
Sure. Well, let's take the time clock and go back to 1996. And in 1996, I knew nothing about cancer. I knew that if you got cancer, you would just do chemotherapy, radiation, and surgery, and that was it. That's standard of care. And in 1996, my father was diagnosed with cancer. Actually, prior to 1996, he was diagnosed with cancer 2 other times. Once with breast cancer, which is unusual in men. Several years later, he was diagnosed with prostate cancer. But in 1996, he was diagnosed with an aggressive lymphoma. Lo and behold, the doctor said that his lymphoma might be vulnerable to chemotherapy. They wanted to bring out the big guns, as they put it, as the oncologist said. And we tried chemotherapy, and he tried one cycle. After one cycle, the nurses did not think he would survive more than 24 to 48 hours. The chemotherapy was so powerful. He did survive the chemotherapy, but lo and behold, I was told a few weeks later they looked at his situation as terminal. And I felt helpless and I felt hopeless when they told me the word. So on March 29th of 1996, my dad passed away. And it caused me to wonder if there was other things we could do to bring to the cancer therapeutic world that might help people beyond or inclusive of standard of care. So I just started thinking about this. I started reading some books. And then in the year 2001, I had a personal event that happened. And I decided to increase my life insurance. And when you increase your life insurance, you go for a physical, you go for blood work. And I was told after getting the blood work that I had very high elevated liver enzymes. They were going to give me insurance, but not at the premier rates. And I said, what's these high liver enzymes? They said, well, you have high liver enzymes, and I'm sorry, that's the case. So I sent the test results to my doctor, and lo and behold, to make a long story short, he did an ultrasound, he did a CAT scan. He said, you do have evidence of a fatty liver. And it was interesting. He said, do you drink a lot? I said, no, I don't drink hardly at all. I have maybe 1 or 2 beers a week. That's it. I don't drink hardly at all. Maybe at a wedding, I may have a gin and tonic. That's about it. So he sent me to a specialist, and the specialist took a lot of blood out. They tested for all kinds of things. But my liver enzymes are going through the roof stratospherically. And I was having serious discomfort right where my liver was, where my liver is 12 times per day. And it felt like somebody was squeezing my liver with a vice. And they were concerned. And he said words that scared me. He said, I want to do a biopsy on your liver. And the biopsy word was a little frightful to me. I saw my mortality flash before my eyes. And I said, I'll tell you what, let me make a deal with you. Give me 30 days. Let's wait 30 days. And if I can move my numbers, my liver enzymes toward the normal range, we'll put off this biopsy. He said, okay. So I read a book by an Australian doctor and a European doctor. And as a result of reading this book and doing some personal research, I made massive transformational changes to my nutrition. And I went primarily with a plant-based diet. I eliminated the standard American diet. If you look at the acronym for Standard American Diet, it's SAD. It's kind of sad. And went largely with a plant-based diet. I was drinking 24 to 36 ounces per day of freshly made certain vegetables, such as all kinds of spinach and parsley and kale, carrots and beets, which are good to purify your liver. I took a few botanicals that were supposed to help my liver. Lo and behold, several months later, 6 months later to be exact, I took my numbers to normal from this high range. No need for the biopsy. And they said, hey, keep doing what you're doing. And the botanicals I took, I think were helpful in concert with my nutritional changes. So I wondered at that point, could you incorporate certain lifestyle changes that could alter the disease process and specifically alter the cancer process? So it was these two things really: my father passing away, my personal situation, and then the realization that cancer, as such an insidious disease, is prevalent all over the world, and it's now neck and neck with cardiovascular disease, quite frankly. If you go back to the year 2017, there were over 600,000 people in this country who died of cancer, and 1.7 million people were diagnosed with cancer. To put that in context, for those of us who remember the war in Vietnam, over the course of 10 years, 58,000 US soldiers died. That's in 10 years. Every 5 weeks, 58,000 people die of cancer. If you think about automobile accidents, 35 to 40,000 people die every year of automobile accidents. And we read every day about someone who died in a car accident. Well, every 3 weeks, 35 to 40,000 people die of cancer. So we really have not made great progress. We've made some progress, certainly, but it's very challenging. And we're about to pass cardiovascular disease as the #1 killer in this country. So I just wanted to make a difference and inform people that there are other treatments and therapies that we can bring to the table and incorporate with conventional medicine to help improve our outcomes, to save lives, to extend lives, and to enhance quality of life. It were these things that stimulated me to jump in with both feet into this cancer world.
That's so inspiring and amazing, Rick. Hear about your story, and especially what your it's unfortunate what your father went through with his cancer and his treatment, and then it's really inspiring what you did with your own health and being able to bring your liver enzyme levels down with the help of leveraging the right supportive care modalities and using the right nutrition and exercise. And as you mentioned, there is a place for that, for taking care of yourself. At the end of the day, food is medicine.
Well, of course, as Hippocrates says, food is let medicine be thy food and let food be thy medicine. By the way, regarding the changes I made, these were not made in moderation because, and I guess I did not have cancer. Maybe I was getting close to that stage of potentially having cancer, but it takes serious compliance. It takes serious adherence to a program, not just, well, gee, on Tuesdays and Thursdays I'll have broccoli, and on Fridays and Sundays I'll have wild salmon. I mean, it takes, to change the microenvironment and to change one's biochemistry, it takes significant compliance and adherence to a program, every day. It's really critical.
Yeah, so let's talk about that a little bit. Let's talk a little bit about what what are the specific regimens or foods, exercises, stress reduction, things that people can look at as they're going through treatment, whether it's for cancer or in general for other diseases, to help with improving their immune system. What are your thoughts
Sure.
regarding that?
Sure. And before we get to that, and I will
Mhm.
happily delve into that, let me set the platform, set the table a little bit, because
Mhm.
regardless of your cancer situation, attitude is really critical. And when we're given a diagnosis of a very serious cancer situation. Let's say it's an advanced cancer, stage 3, stage 4, or somebody even says that you're terminal and you have a limited lifespan. You have an expiration date of 3 to 6 months. And those are horrifying words to hear. Everyone is scared to death when they hear those words. They're mortified. But it's important to try and find that inner resolve, that inner strength, whether it's a day or two later, a week or two later, a month later, and approach this with some kind of an attitude that you can live, and that there are people who have lived very, very long lives. Given evidence is in my book, The 20 Stories, and the fact I've probably met over 500 people at 27 cancer conferences in the last several years who were told by lots of cancer centers that there was nothing more they could do, that they could arrange hospice. But they're here 10 and 25 years later. So having
Mhm.
that positive attitude is really important as a foundation, and knowing that you are not a statistic. Because lots of times we are given statistics, people who have serious cancer situations, in terms of time frames again, and everyone's an individual. Statistics are based on large samples of people, tens of thousands or hundreds of thousands of people. But what you do once you're told that you have a serious diagnosis and a poor prognosis may be different from 90% of the people out there. So that can certainly impact outcomes, longevity, and quality of life. So those, I think, are cornerstones before you take on any particular type of protocol, whether it's conventional, integrated, or alternative. But in terms of what you mentioned, certainly in terms of nutrition, it's not just about wild salmon or broccoli. It's important to get together with somebody who's an integrative oncologist, an integrative cancer doctor, somebody who specializes in nutritional oncology, perhaps a naturopath who has specialty in oncology in concert with a conventional doctor working in tandem, who understands the power, the profound power and benefit of nutrition. There are lots and lots of studies out there that you can find on the internet, and actually in something called PubMed.gov. PubMed.gov has 27 million studies on it globally, and it's actually governed by the National Institute of Health. And you can research and find all kinds of protocols regarding nutrition that work very well. But regarding nutrition, it shouldn't be just a generic approach. Certainly, there are common sense things that we do, but it should be based on objective criteria because everybody is different. Regarding nutrition, it's important to avoid, to the best of your ability, processed food, refined food. And there's so much processed food and refined foods we find in our grocery stores, things that are that are in a can. You want to go with whole foods, preferably a plant-based diet if possible, and preferably a plant-based diet which is uh, devoid of pesticides and herbicides, things of that nature, which are organic. So those are very, very important ingredients as a base. You want to avoid things that have sugar and added sugar, artificial ingredients, things that are genetically modified. So if we and things that are cruciferous vegetables, uh, Brussels sprouts, cauliflower, greens, spinach, broccoli, arugula, many things like that. You want to avoid alcohol. You want to avoid soda pop. You want to avoid animal protein that is created and raised, if you will, in an institutional setting, in a factory-based setting, because so much of our animal protein is infused with hormones, antibiotics, and other chemicals to make that cattle fatter quicker, to make that poultry and the chicken and the turkeys fatter more rapidly, to grow that farm-fed fish with artificial ingredients to make them grow quicker. It's like the old food chain. What they eat, we ultimately eat. And in today's world, they're pumped full of antibiotics and chemicals. So it's better if you can have pasture-fed cattle, or grass-fed cattle, or wild salmon and wild fish, if you will. The same applies to poultry as well. And it's better nutritionally when you're fighting cancer or any disease to make that the appetizer, the animal protein, and the vegetables more like the main course. Fruit is also good in moderation. Fruit does have sugar, but in moderation. Whole foods is good, not those delicious peaches in the can that we all like or used to like. Uh, but what you eat can have a profound effect, as was evidenced by the study of one, which was the study of me when I had that cancer situation, but not cancer situation, but when he wanted to do a biopsy on me many years ago. So nutrition, number one, is important. But work with somebody who's an expert in oncology and nutrition. Regarding supplements, supplements I think gets a bad rap sometimes because you can buy supplements everywhere. You can go to your local grocery store and get supplements, and they're pushed all over the internet. But supplements with the appropriate dosage, the appropriate amount, for the appropriate situation can be profoundly impactful. Going back to PubMed.gov, for example, if you put the word curcumin, now lots of us have heard of turmeric it's called turmeric or turmeric. It's a spice. And lots of us have it in our cabinets, our spice cabinets. But curcumin, which is the biologically active agent in turmeric, can be profoundly beneficial. And in fact, I had dinner with the foremost expert on the planet, whose name actually, his last name happens to be Agarwal, Bharat Agarwal, a couple of times. He's written over 500 studies about curcumin. If you put the word curcumin cancer into the search engine for PubMed.gov, which has 27 million studies, you'll come up with literally over 4,000 studies talking about curcumin and cancer. So that's just one of many types of supplements out there. There are hundreds of supplements. If you put the word in green tea and cancer in, you'll come up with over 4,000 studies, and they exist globally. But they can profoundly impact one's body, the microenvironment, and be tremendously supportive of the immune system. Supplements. In some cases, according to Donnie Yance, who's one of the foremost experts on the planet when it comes to supplementation and cancer, he feels it can also have a cytotoxic effect. Largely supportive, but also attack cancer. So supplements in the appropriate dosage, the appropriate types, based on objective criteria and studies, can be profoundly effective. So nutrition and supplements, working with experts, can be tremendous. Exercise. Everybody can exercise. If you're in a wheelchair, you can still exercise. Instead of eating that food in the can, take a couple of cans of food and use them as weights as you're watching that commercial on TV to develop some muscle mass, to avoid cachexia. And exercise brings oxygen-rich blood to your tissues, which is quite healthy. Cancer does not like fresh oxygen. It likes an anaerobic environment. So exercise can help with fatigue. It can mitigate anxiety. It can help us all sleep better. So exercise is profoundly important. And there are actually experts in the exercise field when you have cancer that can be tremendously helpful. So if you incorporate nutrition appropriately, supplementation, and exercise, they can be profoundly beneficial. Also, mind-body types of therapies. Mind-body is important because, again, we're all so petrified when we hear that we have cancer. So what does mind-body mean? It depends on the individual, and different things work for different people. For example, some people, meditation can work very effectively to reduce stress. For some people, prayer can work. For some people, music therapy, humor, taking stress reduction classes to calm ourselves down, learning how to breathe effectively to calm ourselves down so we don't have this high-stress internal environment that's constantly working against us. So trying to focus on many different therapies, biobehavioral therapies, that can help. So those are 4 different things that can be profoundly effective. Another thing that can be profoundly effective is what I call progressive chemotherapy. Would you like me to talk about that at all?
Yes, please. I've been looking forward to it.
Okay, certainly. In this country, when it comes to conventional medicine, there's the National Comprehensive Cancer Network, the NCCN, which is comprised of 27 major cancer centers throughout the country. These are the 27 centers from coast to coast. Recommendations are made by these cancer centers about the best protocols to take, the best chemotherapy for a particular type of cancer, which is staged at a particular place, the best types of other therapies to utilize when fighting cancer, et cetera, et cetera. And these are based on large, randomized, controlled, placebo-based, blind studies. Remember what I said earlier. You are not a statistic, you are an individual. So when it comes to chemotherapy, there's certainly a place for chemotherapy. When you have a fast-growing cancer, you need to slow that freight train down, that insidious freight train down. When we have a cancer which is blocking a vital organ from doing its job, and we need to have that vital organ do its job, we need to debulk or shrink that cancer. And chemotherapy certainly has a place there. According to Dr. Dwight McKee, who's in the book, who's an integrative oncologist up in the Bay Area, he thinks we use chemotherapy too often and the doses are somewhat too large quite frequently, because large doses of chemotherapy, as we all know, can spawn other cancers and also attack healthy tissue as well. But again, there is certainly a place for chemotherapy. So there's a Dr. Robert McGurney in Southern California who has a chapter in the book as well, and he utilizes a chemosensitivity test, which he and another doctor in Southern California named Dr. Larry Wiesenfeld, they're both board-certified oncologists, and they utilize this particular type of test. What they do is they test your actual tissue sample, at least a 1 gram sample, against 12 to 15 types of chemotherapies, different combinations, different cocktails, and different singular types of drugs. Now they break that 1 gram plus sample into 12 to 15 different spheroids, so they can test them individually against the different drugs. They can ascertain 1 week later if a particular drug is working well against that particular cancer cell. So it's the closest thing to an in vivo approach, really. It's your cancer cells, personalized rather than just working off of statistics and generalizations about what we do based on thousands and thousands, hundreds of thousands of people. So that, I think, is a wonderful way to approach the type of drug that one utilizes. So in addition to trying to find the right chemotherapeutic approach in terms of the right drug, what about the method of distribution? There's a generic methodology of distribution. And then there's, according to Dr. Keith Block, there's something called a chronomodulated approach. And chronomodulated has to do with timing, chronology as in chronomodulated.
Mm-hmm.
And he believes that when you give the chemotherapeutic drugs at certain times of day, it is best for better outcomes because your cancer cells are more vulnerable at certain times of day. And when they're most vulnerable, that's the best time to attack the cancer. So he does it based on timing. And he actually will attach a port to your body, and you can be getting your chemo when you're in the produce section at your grocery store. He actually believes that frequently it's very helpful to be exercising on his treadmill while you're getting the chemotherapy drugs, which is unlike conventional practice. But again, he is using chemotherapy as well. Another approach, according to Dr. McKee, is a metronomic approach. Metronomic approach means much lower doses, which might be 10 to 20% of a normal dose, given over a longer period of time. This in itself mitigates toxicity, a lower drug approach per cycle. Another thing to do beyond selecting the drug and the particular approach is how do we mitigate toxicity? Because lots of people are more afraid of the treatment than the cancer, because we've heard so many stories about cancer drugs. And the effects can be quite powerful, and they can be quite harmful at times. Of course, there's the other side of the coin to try and knock out that cancer and debulk and shrink the cancer. But they can be harsh, the treatments. So how do we do that? How do we mitigate toxicity? Well, according to Dr. Walter Longo, who's a professor, a PhD at the University of Southern California, fasting. There's fasting approaches. There's studies on fasting. And if you fast, according to Dwight McKee, who's utilized this with his cancer patients, he's the integrative oncologist in the Bay Area, the day before, the day of, and the day after your chemotherapeutic approach, the chemotherapy drugs going into your body, it can mitigate toxicity tremendously. Now, of course, not everyone has the inner vitality and strength to fast for 3 days in a row. Now, fasting here doesn't mean that you can't have water. You can have water. You can have light tea. But he's talking about solid food, certainly. And he has found that it works very well clinically with his patients, and it mitigates toxicity tremendously. So fasting is one approach. Another approach is certain botanicals and vitamins. And there's a body of evidence out there that indicates that certain botanicals, specific to the drugs, certain vitamins, this has been utilized by Dr. McKee, Dr. Keith Block in Chicago, and other doctors around the country, can be tremendously beneficial to mitigate toxicity. There's a lot of perception and belief in the conventional world that these things could be they can counteract and dilute the actual effect of the cancer drugs, chemotherapy. But there's also a body of evidence that says that this is not true at all, and that mitigates toxicity tremendously. And this is evidenced by the work of Dr. McKee and Dr. Keith Block and other doctors throughout the United States. So another area of mitigating toxicity is acupuncture. There are lots of people who utilize acupuncture, and when you have acupuncture immediately after, or almost very, very shortly after your chemotherapeutic regimen, it mitigates toxicity. So fasting, acupuncture, certain botanicals and vitamins, there's a plethora of evidence out there that shows that these things work. Now, there may not be evidence pursuant to what's called a phase 3 study, an FDA phase 3 study. Now, a phase 3 study means that first we study cancer cells under a microscope, then it's studied with mice, then there's a phase 1 with 30 to 50 people, a phase 2 could be 50 to 200 people, and phase 3 could be 300 to 3,000 people. It generally takes, generally speaking, 10 to 15 years to do these cancer studies. They are extremely expensive. According to Tufts University, a 2014 study of drug approval, it costs, and this is Tufts University speaking, $2.5 billion to go through a 10-year study, 10 to 15-year study, all the way through a phase 3, double-blind, placebo-controlled, large randomized study. Now, some people say, well, Rick, it's not $2.5 billion. That's too much money. It's closer to $500 million to $1 billion. But last time I checked, $1 billion is still quite a few dollars. So why do people do studies that cost so much? Because they can have a patent for 20 years and make billions of dollars per year. Again, I'm not knocking chemotherapy. It's worth doing in many cases. In certain cases, certainly it can be helpful. But I'm talking about trying to find a progressive methodology to find the right chemo drugs, to mitigate toxicity, the right methodology of distribution. But you're not going to see these things in a phase 3 study because they are not patentable. You're not going to find these approaches patentable. And no one's going to spend $1 billion for something that's not patentable if you don't have a return on investment. So we live largely in the pharmaceutical world, but there are other things we can bring to the table to greatly enhance outcomes. And I've seen this time and time again because I've met 500 people who were told, time to get your affairs in order. And they're here 10 years later because they introduced other approaches to the overall protocol to fight cancer and support their immune system.
Wow, that was amazing. Such great pieces of information, Rick, that you shared about so many different types of therapies and the place for it. I think that's really important for us to think about when we are looking at our treatment options. Is who are the other providers? If you're thinking about integrative medicine, adding that to your treatment plan, finding the right specialist who can support you, finding the right information that can be helpful. And there is a lot of research and evidence out there about these different modalities, the effectiveness of it. Like Rick was mentioning, right? As you mentioned, Rick, about on PubMed, there are a lot of studies. In fact, NIH's website itself, IAC, for integrative medicine, has a lot of studies on part of IACT PDQ, which is where we publish summaries of the studies that have been effective on different topics. So there is a lot of evidence out there uh, to identify what you can do in addition to your treatment to support with managing a lot of the symptoms, improving your immunity, and doing progressive aspect of treatment, incorporating that whole health approach
Yes.
to it, right? In fact, on our site also, we make a lot of that information accessible and available for you. What are the modalities that are effective for which issue? What is the research behind it? And what are the self-guided things that you can do? So you can definitely check that out. At the same time, yeah, if possible, try to incorporate a specialist into the process with you. And to Rick's point, I think I totally agree with you, Rick, that there are a lot of studies out there that actually show these modalities are effective. It's going to be They're going to be lesser of the um, of large scale studies, because it requires significant amount of financial investment, which may not always be possible. But there are studies that do indicate the effectiveness of things, so it's important to go check it out. Um, what Yeah, what are the effectiveness that have been seen for different modalities and for which specific area, and then from there we can go in and see, does it make sense for me to use it, right, and make that decision for yourself. Rick, you talked, right, I think you covered a lot of really great points. I won't regurgitate them in the interest of time. uh, what I want to do is move forward a little bit, talk more from a research perspective. You touched on that, in terms of where people can find it. PubMed is one place where they can look for research, and they can look for clinicians. Do you have any other suggestions for people as they are exploring different options and modalities, where they can be um, looking for options and resources?
Sure, sure. Well, yeah, and not everybody is research oriented, and
Mm-hmm.
quite honestly, when you go to PubMed.gov, uh, certainly, like I said, there are thousands and thousands of studies, but it can be confusing because it's written in this is medical literature, and it's written in scientific and medical terms. If you don't understand the terms, it can be tricky. But I really think it's important to, let's put it this way. Let's assume you go to your conventional oncologist. I think it's important to create a team of people. And you might want to talk to an integrative oncologist, a conventional oncologist. You may want to talk to a naturopath I didn't know what a naturopath was 15 years ago. Um, and I went to a naturopathic conference, in fact, just a few years ago, and I said, what are they going to teach me? Just to eat wild salmon and broccoli and drink water. But when I came away from that particular conference, I found that they were deeply steeped in science and lots of studies. So you may want to bring it to the team approach, a naturopath who is especially in oncology, or a nutritionist. And these are people who can give you great information and great advice. The internet has its pros and cons. There's lots of information there, but then it can be a dangerous place because you can go down the wrong path with somebody who's well-meaning, but is not giving you good information for your particular unique situation. So seek out experts in your metropolitan area. If you don't have experts in your metropolitan area who can cover the gamut of conventional, integrative, and evidence-based, the key word here is evidence-based alternative, because there's a lot of voodoo out there. There's a lot of nonsense out there. And I don't buy into any of that. There certainly has to be some kind of evidence or basis that these particular protocols work if it's not conventional. But you can do consults with people. There are people in the book, for example, that will do consults. People like Gene Wallace, who's brilliant in the nutritional area, or Donnie Yance in the supplementation area, Keith Block in Chicago, and others. And you can talk to them on the phone, and they can give you guidance. And regarding things like I mentioned earlier about nutritional approaches and supplementation and exercise and mind-body, once you get some fantastic guidance, you can do these things yourself at home. You don't have to run to the doctor, but you will want to have check things along the way and get appropriate diagnostic testing to see how things are working. You may want to tweak some things. But talking with experts is really, really important to get on the right path with some of these integrated approaches.
Mm-hmm, absolutely. Having the right expert by your side is really important. So you're going for recommendations that are actually going to help you and not hurt you or not be ineffective, right? And then being able to explore, has this been effective for other people, so you can do your own background research.
And that's one of the real challenges, because there's too much misinformation and
Yeah.
disinformation, and there are also some charlatans out there. There are people who want to take advantage of those who are vulnerable, and I detest those people. They're horrible. But there's a whole world of things out there that one can implement to create excellent, comprehensive, systemic protocols with excellent healthcare practitioners, putting together a personalized, customized approach for you, which
Mhm.
is a sophisticated approach based on objective criteria. Again, regarding blood work, tissue samples, things that apply to you. And when it comes to these experts also, you want somebody who's compassionate, somebody who cares. Because there are some people who, and look, there's professionals in all areas of the world, but you want to have someone who treats you as if it's their child or their kid, who really is compassionate about your approach. And you want to know that they have an outcome approach to, if not cure your situation, at least to control that cancer. And you certainly want to talk to them and find out, is their approach curative? Is it just to keep something in check? Is it just palliative? Uh, what is their approach when they go forward with you?
Absolutely. I think that's a really key point you brought up, Rick. Is I think a lot of times it may not be very clear um, in terms of what is the goal of this treatment, right? Is it curative? Is it palliative? Is it to support you? What is the probability of success of those treatments, having testimonials, having stories, having data, something to showcase that is really important, because you're taking that chance on your health, on your life, when you're choosing to
Right.
work on those treatments and putting your money into these treatments, right? Your good hard-earned money. So it's really important to understand that, as you mentioned, there are a lot of treatments and people that may not be as effective. So it's important to do your research, find the right people. We try to do that here at Helpsy for you, and help you to know who are the people who are effective in different areas, um, and what is the research behind things. But it's really important you do that for yourself, so you find what works best for you. You can personalize it for you. At the same time, you're not going for things that may not be effective. And where my hope is, and I think where healthcare is moving with the benefit of technology in the next few years, is we can now collect this data at large scale, and that itself becomes real world evidence and big data research, because it's being based on what is happening today with people, and being able to capture that. And that creates this massive database and knowledge of what's effective and in which situations. We are starting to see that already with, with the large number of people using our platform and using the different modalities, in terms of what's effective, what works, what doesn't work, who are the people who are good at addressing issues, and what kind of issues they're good at. So I think all of those can definitely help in making those decisions, Rick, as you were mentioning.
I'd
Um,
like to, if I could just interrupt one
yeah,
second.
yeah,
You mentioned a couple of things. I want to take a half
yeah.
step back about,
Mm,
if the approach is curative, palliative, or just to control the disease as if it's a chronic situation. I remember a quote that Dr. Dwight McKee up in the Bay Area told me, and he said that, of course, stage 4 is called non-curative. If you're stage 4, you won't be cured. But he said to me, he said, that's pursuant to conventional medicine. He's a board certified oncologist, but he's also very integrated, of course. And Dwight's a fantastic oncologist. And
mm,
he said that that's pursuant to conventional medicine. And I personally know many, many people who are here 15, 20, 25 years later, living wonderful lives, who were staged at stage 4 or terminal 15, 20 years ago, literally. And the other thing, you talk about data. lots of people will say, well, what you're talking about, Rick, is just anecdotal. But when you have lots of testimonials and lots of anecdotes or anecdotal stories, you have data, you have information. We cannot just ignore patient experience. It may not be a phase 3 double-blind randomized large study, but when you have this information, there's much to be learned by, according to Dr. Bernie Siegel, there's much to be learned by those people who do not die, who, according to conventional prognoses, were supposed to die. So it's almost like reverse engineering. What did they do?
Absolutely,
So
absolutely,
that's
very
important to
important.
consider as we move forward, because science constantly evolves, and there are therapies and treatments out there that right now are not part of standard of care, but according to Dr. Keith Block in Chicago, they should be standard of care, and we
Mhm.
wish they were, especially nutritional oncology and appropriate supplementation. Keyword there is appropriate.
Very true, very true. I mean, a lot of things in our mainstream treatment first started um, as a holistic approach, right? And as it built evidence, it eventually became mainstream. So I think it's really important to recognize and highlight these stories, which brings me uh, to the stories that you have talked about in your book. Would you mind? Would you consider sharing some of the stories and the interviews that you've conducted on people thriving and surviving cancer, and what was the approach that they took? Like you said, it's about reverse engineering and understanding what helped them to beat the odds, and perhaps there is some learning for all of us here.
Sure. Yeah. Well, there were 20 fantastic, remarkable stories. I've met 500 plus people, but I'll highlight 2 or 3 stories here, and I'll go through them and use their exact quotes, these patients, and what they said, what they experienced. That might be helpful and bring a little bit of humanity to the stories. So first, there's Diane Klenke. I'll talk about Diane. Diane had pancreatic cancer, and she was told, quote, you have 3 months to live. We can arrange for hospice care. So basically, one Friday in February, and this is Diane speaking, one Friday in February of 2004, while working at an insurance office in Green Bay, Wisconsin, the entire staff came down with a nasty virus. Everyone went to the emergency room. Diane had blood work, she was given a shot, and the following Thursday, 6 days later, she had an ultrasound at a local hospital. She was told she should spend the night at the hospital for more tests. She visited with her doctor the next day, and her doctor said, you have a very large tumor in your pancreas, 3 tumors in your liver, and tumors around your portal vein. A few days later, a surgeon in Green Bay told Diane, this appears to be a widespread cancer. You might as well go home and get your affairs in order. You are inoperable and don't have long for this world. Imagine hearing those words. Well, she had medical records that were sent immediately to a well-known hospital in Minnesota. She had her liver and pancreas biopsied. Diagnosis was cancer, obviously. The oncologist and surgical oncologist said, quote, your chances of survival are maybe 1%. I would give you maybe tops 3 months to live, and we can arrange for hospice care. Back in Wisconsin, a Green Bay oncology group was willing to treat Diane with chemo despite the grave prognosis. They said, quote, eat anything you want. You need calories, ice cream, whatever. Diane said, I have cut out sugar and dairy, and I am now taking vitamin C supplements. The Green Bay doctor said, we won't treat you if you take vitamins. It will interfere with the chemo. The doctor said, quote, lady, you are terminal. Prior to starting chemo, a relative of Diane's recommended the Block Center for Integrative Cancer Treatment. Diane postponed her chemo appointment and made an appointment. Dr. Block offered hope. No promises, but he said, quote, I think we can alter this cancer. Dr. Block continued and said to Diane, the immune system is like an army. We need to strengthen the army to stop the progression of cancer and to strengthen the body. Basically, his treatment strategy was as follows. Chronomodulated chemotherapy, in other words, timed distribution, as we discussed earlier, with supplements and vitamins prior to the chemo to help the normal cells survive the harsh side effects of chemotherapy. Secondly, supplements and vitamins. And Dr. Block prescribed literally 50 to 80 specific supplements per day, tailored and personalized for her specific condition, based on objective blood work and other criteria. Number 3, a nutritional strategy. Organic vegetables, fruits, whole grains, beans, spinach, green tea, almond milk, fish, no sugar, no fried food, no red meat, no dairy, no foods with white flour, which are simply bad for you. Simple carbohydrates as opposed to complex carbohydrates. But a nutritional strategy catered for her situation. And number 4, a mind, body, and visualization approach, working on psychosocial and biobehavioral issues to reduce stress and to get her in the right frame of mind moving forward. So essentially, chronomodulated chemo approach, supplements, nutritional, mind, body, and visualization. And oh, by the way, also there was exercise regimens included. Diane said, you must make your body inhospitable to cancer. Diet, supplements, chemo, the way Dr. Block does it, exercise and prayer are big reasons why I am here today. And then she said, Dr. Block told me, don't ever consider yourself cured of cancer. You must stay with the program. You may always have cancer cells. It could cause problems, again, even if you're 10 years down the road. And she closed by saying, you must change your life and your lifestyle. So, important words when it comes to your body, your biochemistry, and the root causes that brought about the cancer in the first place. Would you like to hear another story? Can you hear me?
Yes, yes,
Okay.
I'd love to hear the story.
I lost you for a second. Okay. Then there's a woman named Janet Summer. And Janet Summer was told at a certain point in time, literally, quote, you have 3 to 6 weeks to live. So Janet was born in 1950 in Ohio. Her parents smoked 3 packs of cigarettes a day. Janet had a very poor diet. She was divorced at the age of 40. At age 45, 1 month before her diagnosis, she felt particularly fatigued. Diane led a very stressful life. Diane was actually a nurse and a nurse educator. She taught nurses about nursing and about science. Diane thought at one point she might have bronchitis. She was coughing a lot, and she had this chronic cough. She went for an examination. The doctor said, you don't have any problem. Everything's fine. So she went back to the tennis court. She'd love to play tennis, and she asked a doctor, a friend of hers, for an antibiotic. He agreed to give her an antibiotic because she thought she might have pneumonia. He said, I want you to do a CT scan. I want you to do a CAT scan as well to make sure you don't have pneumonia. So she did the CAT scan, and she did a follow-up PET scan, and it was shown that she had tumors in both lungs, the pancreas, liver, stomach, and lymph system. On April 11th of 1995, so we're now going back almost 25 years, she was diagnosed with non-small cell lung cancer. Diane said, quote, I was absolutely shocked. The first doctor said, you have 3 to 6 months to live. There is no hope. A second medical opinion that she got at a hospital in Cleveland said, quote, you have 3 to 6 weeks to live. Janet told her son, I am going to die. On April 18th, 1 week after the diagnosis, Janet had surgery to remove the stomach mass and began chemotherapy. The doctor said it might buy you a month or 2. The plan was to have 6 chemo treatments, Taxol and carboplatin, but 3 weeks after her first dose, her very first dose, she went from 114 pounds to 72 pounds, literally. And Janet said, quote, I looked like a concentration camp survivor. It was impossible for me to continue the chemo treatments. At that point, Janet entered hospice care. Her internal medicine doctor, her primary, said, why don't you try something alternative? And Janet responded and said, that's for hippies. Anything besides allopathic medicine is mere nonsense. And Janet's doctor said, you have nothing to lose. Look into macrobiotic food. So reluctantly, Janet found a macrobiotic counselor from the phone book. Again, this is back many years ago, the phone book. Do you remember the phone book? Anyway, Janet said, he didn't promise a miracle cure, but he gave me hope. And Janet said, my lungs were filled with fluid. I was on oxygen, using a wheelchair, and needed help to get to the bathroom. Janet continued and said, I was fortunate to have an incredible support system of 8 friends who cooked for me every meal, every day. Remarkably, 2 days after I started the diet, she said, I stopped vomiting. She said, and she continues, during the first 5 months, my tumors kept growing, but slowly. I didn't want any more bad news, so I told my doctor I don't want any more scans. Janet said, I was not into deep breathing and prayer, but deep breathing seemed to alleviate my pain and help me relax. I also had full body massages, which were soothing. 10 months had now elapsed since I began the diet, and 1 year had elapsed since my diagnosis. I decided to get scanned to see what was going on. Janet said, I was scared and curious. I had lived longer than most expected. A few days later at 9:30 p.m., my doctor called and said, quote, all your tumors are gone. Janet said those were the best words I had ever heard besides, it's a boy. So Janet then went before the tumor board. She had a tumor board presentation where there were 15 people in the room, several oncologists, nurses, hospice workers, and other doctors. Janet said that scans were shown at the presentation. One doctor said, it's impossible that this is the same person. But fractures in the ribs were visible from both scans, substantiating the validity, because she had fractured a rib many, many years before, and they had that scan and the current scan. It was the same person. This was her. Janet then said, another doctor rationalized, it must have been the 1 dose of chemo that did the trick. But another doctor in the room said, no, that doesn't make any sense, because when we give all 6 treatments for this type of metastasized cancer, 6 cycles don't work anyway. So I'm thinking to myself, they said 6 cycles don't work anyway. Why are they doing this? Anyway, to continue, Janet said, my doctor said, whatever the cause, she is here, and this is what she did. Janet continued, during my first year in hospice, I gave away many clothes, thinking that I was a goner. I learned that stuff is not important. I was in hospice care for 18 months. I believe how I eat impacts every cell in my body. I am now more open and trusting. I used to be cynical and angry. I believe anything is possible. I thank God for my story because it gives people hope. Janet continued, since I left hospice, life has been great. People who embrace this lifestyle heal, but they must stay with it 100%. In fact, Janet told me also that she had friends of hers who had cancer who went on this changed lifestyle, this particular diet, and the cancer went away. They went off of that, went back to their old eating habits. The cancer came back and they died. Janet said, I thank God every morning for the new day before my feet hit the floor. And at the end of my interview with Janet, she said, never give up, never give up, never give up.
Wow. That's
That's
so
an incredible story. And it's a true story. Would you
so-
like one more?
sure. Yeah.
Okay, here's another story about Elizabeth Pankey. Elizabeth Pankey had ovarian and uterine cancer with metastasis to the stomach. Elizabeth was somebody who was told you don't have more than a few weeks, maybe 2 months to live. Elizabeth was born in Poland in 1950, and she was very accomplished scientifically. A master's degree in physical therapy, a PhD in experimental pathology, an MD degree from the University of Cincinnati, a fellowship in molecular biology, and she was an international expert in DNA. So she had a deep medical and scientific background. In June of 1999, during the gynecological exam, and now that goes back 20 years, Elizabeth's doctor discovered minor irregular bleeding. In late June, an ultrasound revealed a large tumor on her ovary. And on July 6th, the doctor informed her she had stage 3 ovarian and uterine cancer, which had now spread to the abdomen. Elizabeth said, I was shocked. I was so angry. Why did this happen to me? She continues, 1 week after my diagnosis, a surgeon removed my ovaries, my uterus, and any visible cancer. I went with the standard chemo for my type of cancer 2 weeks after surgery. They said the chemo would probably take care of the problem. I lost all my hair, was getting Taxol and carboplatin. I took nausea medication and continued to work, but the experience was strenuous. It was very rough. She said, my cancer grew aggressively despite the chemo. I developed a tumor on my spleen. A gallon of malignant fluid was pulled out of my abdomen every 5 days, full gallon. Then she said they tried another chemo drug, but nothing good happened. I traveled to 5 prestigious cancer centers throughout the United States. I had metastatic cancer. 2 different types of chemotherapy did not work, and the cancer was spreading. These cancer centers and my doctors did not know what to do. At this point, in October of 1999, several cancer doctors told me I needed to face reality. It was doubtful that I would make it until Christmas. I was in disbelief, angry, upset, and desperate. I had heard of chemosensitivity testing. I inquired about it, but all of the cancer centers said it didn't work. Yet I needed to take action immediately. I was dying, and I had no time to waste. I wasn't giving up. I searched the internet night and day and found Dr. Robert McGurney's website. He is an oncologist who also operates a chemosensitivity laboratory in Long Beach, California. I got him on the phone and was very impressed with his opinions and research. Immediately investigated everything he said and decided to send him a fresh sample of my ascites. Dr. McGurney gave me hope. Within a few days, he called me and said, I have a combination that is making the cancer cells just melt away. I flew to California and saw Dr. McGurney the very next day. He drew malignant cells from my abdomen and then injected the chemo into my abdomen directly at the tumors. He wanted direct contact. No one else had recommended this procedure. I was anxious, but also hopeful. He also injected the personalized chemo cocktail into my vein. Then for my second treatment, he drew the fluid out only about a quart, not a gallon. It looked like the malignant cells were beat up. After the second treatment, which was just 3 weeks into my chemo treatment, there was no more fluid to withdraw. By Christmas, there was evidence of chemo cells in my body, confirmed by my scans. I was supposed to be dead by Christmas, but instead my cancer cells were dead. I informed the major cancer cells that I had visited of my wonderful outcome, the fact that the cancer was gone. To my dismay, all they had to say was, lady, you are lucky. Elizabeth continues, since my successful treatments, I came to accept what is and enjoy the moments in life. I don't have all the answers. My role is to do the best I can in my life every day. You must want to live. I find that cancer cells who do the best become self-advocates, who direct their own therapies versus just going along with their doctors. And she closed by saying, people shouldn't lose hope. Keep searching, follow your heart.
Wow, just so inspiring, so positive, and it's really great to hear of stories of people, who've explored these opportunities when they heard there was no other option and the positive outcomes they've had.
They kept fighting. They had a no quit attitude, and they actually had a little bit of. There were similarities out of the 20 stories, certainly, and the similarities regarding the 20 people for most of them. For example, Elizabeth Pankey, she found Dr. McGurney and found the right chemotherapeutic approach, which was different from the standard of care approach. And this was based on the chemosensitivity test done by Dr. McGurney. Regarding Janet Summer, she found a particular nutritional approach was fantastic. And according to the approach done by Diane Klinke, she did a multifaceted approach. But most of the people in the book, most people that I have talked to and met with over the course of the last 10 years, took a multifaceted approach, bringing most of these therapies to the table in a sophisticated manner, systemic manner. They found a team of the appropriate healthcare practitioners, and that could be an integrative cancer doctor, it could be an open-minded conventional doctor working with complementary specialists, and they would base these approaches based on objective criteria, the appropriate blood work and scans, etc., the appropriate tissue samples, with people who really cared, compassionate healthcare practitioners.
Mm-hmm.
So utilizing a variety of approaches is really important because cancer is wily, cancer is complex. Mutations change. You can have different mutations in the same tumor, let alone the same individual. And they evolve and they change. So the multifaceted, comprehensive approach I have found in my research to be the best approach. Instead of just a rigid one-stop approach, trying to find one silver bullet as opposed to a multifaceted, comprehensive, systemic approach.
Absolutely. I think that's so true. I think you touched on some really key points. The commonality across all the stories is having that, bringing the experts in, having a comprehensive, systematic, very specific approach to care, having the right attitude, uh, and really being very mindful of your diet and lifestyle, and using the supportive care modalities in a very evidence-based way. And these true life stories show us the power of what's possible when you bring that together in a systematic approach. It's really very powerful, very inspiring. And having known some of the providers as well as the patients that you're talking about myself for so many years, I think it's a good inspiration message for everyone. I'm just so grateful for your time, Rick, and for everything that you have shared. I hope that a lot of people who are listening or have seen pieces of this get a chance to go check out your book, and read these different stories, read the points that are common, and um, where they can learn about what they can do, as well as about the providers who have been in the forefront of this. So thank you so much for your time and for sharing all your thoughts. It's truly an honor to have you here. And to all our audience, thank you for your time. I hope you enjoyed this, hearing Rick's perspective, and I hope you will go check out his book. It is available on Amazon, and it has very inspiring stories and a lot of knowledge pieces on what you can do, how you can explore it. So with that, I thank you for your time and have a wonderful week. We will see you soon.
Thank you.